You are watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, laser dentistry, specifically for the treatment of gum disease. According to my first guest, no more bleeding gums, bad breath, puffy gums, loose teeth, that with the use of this laser targets the bacterial infection in your mouth and that you get fresh breath and those symptoms go away. With us, we have an expert on the topic, board-certified periodontist, Dr. Guzman. Dr. Guzman, welcome
Hi,
to the program.
Randy. How are you?
So we've had you on the program talking about dental implants, but for people that don't know who you are, tell us a little bit about your practice. Like, what are the different procedures you do? I think we've talked about this. I mean, you do just about everything.
Well,
all right under one roof.
Pretty much. I mean, we have almost every specialty, and that allows us to give or provide a wide range of services. We go from tooth whitening, wisdom teeth extraction. We have, of course, dental implants where we have different options. We have single teeth, multiple teeth, options for patients wearing dentures, root canals, cone beams, sedation, basically everything, a little bit of everything.
And you do the crowns in the same day?
Well, we have the ability to do that, right? I mean, you know, when we're looking into a cosmetic service or an option, you can go from a dental veneer to have a porcelain crown, a full porcelain crown. Crowns in a day, that's the CEREC system, which we have it. Basically, they come in, they probably 2 hours later, they're walking out with a crown. Depending on what the patient needs, the idea is to come in and determine your options. See what we have to offer.
So moving on to today's topic, gum disease. We say that new laser treatment has changed everything.
Right.
So periodontist, this is your specialty. So how does your training differ, or what were you trained then, or what did you used to think now that you've learned using the laser?
Right. So, well, let's do this. So potentially about 15 years ago, I went to Boston University, probably one of the leading universities in periodontal training. Everything we were trained on was conventional treatment. It's basically you're dealing with the consequence of this infectious disease. I mean, basically you are cutting away the excess of gum because the bacteria has created an area that you lose. Your gums are detached from the teeth, so we gotta eliminate that. Now, what has happened though is, yes, we're able to control the problem. Yes, we're able to save teeth. The problem is the consequences are sometimes very long teeth. Now, when it's in the back...
Long teeth? What do you mean long teeth?
Well, what happens is because we're removing the gum tissue off the teeth, then basically you end up with receded teeth.
So an illusion that they're longer.
Yes, what I'm saying is because we're removing gum, the tooth will look longer. Basically,
so cutting out the
you are exposing
infection.
the root. Yeah, now the root is exposed. Now, when it's in the back, often there's really no concerns other than potential sensitivity. I mean, patients will have cold or hot sensitivity for a while. Now, the issue is when you have to treat a front tooth, then now you are really creating a lifetime problem for that patient. Yes, healthy, but awful.
So as a periodontist, traditionally, you would cut out the diseased tissue. Am I catching that right?
Yes. If we needed to eliminate a gum problem, that's what we would do. Now, this is when the lasers, especially now, these perilasers come through. Now, lasers have been in dentistry for a while now. Now, the truth, though, is that as a periodontist, we've been very skeptical about it. These perilasers, for example, FDA approved, they started about 14 years ago. It's until now, probably 3 or 4 years back, that now research starts showing the type of outcome that we were looking for. Now we have histology studies. Now we have a very specific studies that are showing us that this thing works. It's a predictable treatment, but the best thing is that we're not ending with the same outcome that we had before. That tooth that I was telling you that it was elongated, or it looked like it was longer because we removed the gum, now we don't have to do that anymore. The second thing that we do is because we have better access, the laser, the energy that is on the laser, has the ability to be sensitive about, it kills only the sick stuff. So basically you apply the laser, it will remove only the bacteria off that tissue, leaving the volume or the amount of gum intact, and you don't end up with a residual.
So why is it then that where you go around the mouth with a laser, kill this bacterial infection, that's gum disease, and is that periodontal disease and gum disease same thing?
It's the same thing,
okay.
Yes.
When you kill it, how is it that their breath gets better? Their gums get better.
Right.
No more bad breath, loose teeth. Well, that's the part I'm not getting.
Right. It's because they're all associated with the same. It's bacteria is what, the bad breath, bleeding gums, puffy gums, sore areas, it's all associated with the same. once you use the laser, all those symptoms should disappear immediately. I mean, seriously, and because there's no gum cutting, there's no stitches, then the aftermath is so much easier. So patients are coming back. I usually see them about 5 to 7 days later. They're coming back, they're literally surprised, or happily surprised of how easy was this. Actually, I have some patients who have gone through conventional treatment. Again, our practice has been established for over 40 years. So I have patients who have seen, or our previous periodontists in the office also have seen, and they have done half of the mouth. They say, forget it.
So half of the mouth
I'm
with
not
the
doing
cutting,
it again.
the old
That's
way.
right. I'm not doing it again. Then after years, unfortunately, that problem continues. So good thing is it takes a while. So 5, 6 years later, we're saying, listen, Mrs. Jones, it's time. We have to do this. But we have now this other option. She's coming back and saying, listen, I wish you did this 10 years ago. This was nothing compared to it. So that's what it, so the patient side, from the patient's perspective, is a much easier procedure. Less pain, is basically literally no swelling, no pain, no.
Very little pain.
That's right.
Okay. Now, in your so you're a periodontist, and anticipating you coming on, I've had our show airs throughout the U.S. with medical doctors and dentists, and I know that it seems like they're divided, or maybe they're not. Just the ones I'm talking to. Some periodontists love this, swear by it. Others say there's not enough research.
No, we're clearly divided, and I think it's time, and I think that surely, I think in a number of years we're going to start seeing a lot more people involved. I mean, even in the last meeting that I went to, I mean, I've been following this group for about 3 years now. And every perio meeting that I go, I'm seeing more and more of my colleagues. In Boston.
You tell them to do it.
Well, some of them I have. Others, they just looking on their, once you see the results, you can't
Results
stop
meaning
it.
getting rid of the problem, killing this bacterial infection.
Patients coming up with teeth that were supposed to be out. Patients that came in with puffy gums, hurtful areas that often, probably 5 years ago, I would have removed those teeth. I mean, I have saved teeth today that 5 years ago I will not save.
So saving teeth with a laser.
It is a different approach. It is a different approach. And then it's safe. So sometimes the patients are like, well, what's the worst thing? What's the worst case scenario? The worst case scenario is that if it doesn't work, we're back to where we started it. So we still have all other options that we have.
Why'd you end up doing it, by the way?
Because again,
were you talked into it by your buddies?
No,
other dentists.
So I attended a meeting that we were talking about actually practice management, and we started talking about what other what's the latest thing that we're doing, and at some point we started talking about lasers, and a large number of the attendees actually raised their hand, and I started talking more and more, and when I started looking into it, that was probably 3 years ago. Now, recently, I started looking into what it is. You go through the training. It's a very safe procedure. They have it very well organized. So the main issue is lasers could have a bad name. There are about, by the way, 20 plus lasers in the market. Not every laser is the same thing.
So only one is FDA approved.
That's right. And not
for
to get into
periodontitis.
the physics. Right. But it's wavelength, it's pulse duration. They're all different. So periolase, it's what's going to allow you to remove the bacteria off the tissue, leaving the whole bulk there, basically changing the balance from degeneration to regeneration, is allowing your own body to literally create back the bone and the gum that it was missing.
Well, logically, and I've had, he heads up the perio program at Albert Einstein and the University of Pennsylvania,
right.
And he was trying to explain, he said, Randy, it's a bacterial infection. I'm paraphrasing slightly. It's a bacterial infection. He goes, it's unbelievable that in today's date that we would try to cut out this bacterial infection when what we should be doing is treating the bacterial infection. And the laser, I guess, targets, as you say, the colors of the bacteria.
Right.
So, I mean, logically, it makes more sense.
Well, and it also is becoming more effective because, for example, part of the conventional treatment, we had to not only flap the gums aside, so you cut the gums, flap it aside, you start scaling and cleaning the roots. But there is a lot of crevices and angles and the tissue.
Good point.
You can't clean it.
But you do sterilize the area even when you do that area, though, right?
Well, not everything, because you can't. If you don't get access, you're then counting on your immune system or maybe systemic antibiotics to kill the remaining bacteria.
Okay.
And this is all conventional treatment. Nowadays, we've seen how the tissue responds to that laser treatment, which is basically.
So it works.
It does.
And when I say at the top of the show, no more bleeding gums, bad breath, loose teeth, things like that, I mean, that's possible if you catch people early enough.
That's actually a key. I mean, I wish there, even though this is, I don't want to say this to be a miracle. I mean, it's not a matter of saving hopeless teeth. We're not here to, well, if you have been told by everyone that your tooth cannot be saved, keep looking until you find someone who says yes. That's not the point. The point is, if we catch this early, we will be able to fix your problem, no consequences, no detrimental issues, no recession. So that's, the message here is, if you have early on signs that we have talking about puffy gums, bleeding, flossing, patients that say, well, listen, I just bleed when I floss. Bleeding is not normal. Patients actually said that, well, Dr. Guzman, it's only when I floss, so they really don't bleed. It's like
but that is normal, though. I mean,
it
bleeding
isn't.
gums when you floss.
Actually,
no?
it's not supposed to. No. Bleeding is just showing you that your gums are swollen. They're
That means
inflamed.
you have an infection.
You do have a bacterial
You
infection.
have gum disease?
Well, not quite. No, you might. You might have it, or you might have gingivitis. You might have the beginning of it. See, bleeding is not normal. But we don't know the extent of the problem only through bleeding.
But you're definitely headed toward...
You definitely got to go and get an exam. That's really what you got to do. Because it's going to be through the examination, x-rays, and all the oral exam that we're going to determine where are you and what your options are.
Isn't the number one way people lose teeth?
That's actually true. I mean,
periodontal disease,
it's
gum
such
disease?
a big deal that 1 out of 2 people, 50% of the population today.
Is that right?
It is.
Have it.
It will have some type of periodontal disease, yes.
Okay. And, on the phone, I like this. You said, Randy, I don't want to come on your program and exaggerate or something like that. You said, I don't use it on every patient. I still do conventional surgery. Right. So, but, 9 out of 10 cases, I use the laser. Well, that's a lot. If 90% of what you used to do surgically, you're now doing with a laser without cutting or stitches, that's big.
It is. It is big, and I think that's kind of a key. That's what we were saying. I think that even though there may be cases, again, because we work in a group practice and we're looking at constantly at this comprehensive approach, where we use the team to solve not only the gum problem, but you may come with gum problem, and at the same time there's a couple of teeth that are broken halfway, or you're missing a tooth and we need to do something else. So we have to include that. So that's why I'm saying that not every periodontal problem I deal with it with laser.
Yeah, but 90% of the people you're able to get. Now let me ask you this, because you said something on this phone is very interesting. That if you were told you have a bacterial infection anywhere else in the body, you would do something about it. But in your mouth, the hygienist tells you, the dentist tells you, we think you have gum disease, a bacterial infection, and they do nothing.
And we going back to the bleeding. The same thing with the bleeding. If your eye was bleeding, your ear was bleeding, I mean, you would say you're run out. It's the same thing.
It's not a fair analogy, though.
But it is. Bleeding or infection is not. Often we tell our patients, but I think it's driven by fear. I mean, they have gone through a lot of dentistry.
So it doesn't hurt. I mean, fear of what? A lot of pain?
A lot of they've seen. When you describe the conventional treatment. Okay, well, so they say, well, Dr. Guzman, what are you actually going to do? And then I have to ask, do you really want to know? You're like afraid that you're going to take that patient away. Because when you describe conventional treatment and you said, well, I'm literally going to create an incision on your gums. We're going to flap these gums apart. Then I'm going to have a drill and I'm going to start, On the other hand is, well, let me show you a video. So we have this animated video that we just use. And basically the laser just go around your teeth, killing bacteria. Then we use an ultrasonic, we clean it up. And you're done. There's no stitches, there's no cutting.
You guys even have buttons that say like no cut or no cutting, no sewing or something like that.
That's right. And it's basically trying to simplify the main advantages. It's trying to eliminate the fear of a patient because, as you said, if we were able to get these earlier, I think we'll be, in general, a lot more effective. We have to get the people to go to the dentist. Every time they see a sign, it's a lot simpler. We could probably do a lot better if patients are just reacting to this and then attending to the dentist.
People don't like going to the dentist. And when they hear, my guess is, when they hear they have to go to the periodontist, that's the worst.
That's right.
I mean, you don't get much more bad news than that.
Well, you get it both ways, because you could have it actually someone who, as you said, has no idea that they have a problem. They go to the dentist and say, you know what, I'm finding stuff that I'm not happy with. You got to see the periodontist. They are really, really skeptical about it. On the other hand, we find also patients with, dealing with bad breath, long-term bad breath.
How soon could the bad breath go away? Or have you seen it go away?
Immediately. I mean, again, this is a day response.
When I hear it's bad bugs, you have a bunch of bad bugs underneath your gum line.
That's right.
Is that right? Is that kind of what it is?
It's, well, what happens...
That makes you laugh? Why does that make you laugh?
Because it's a simplified way of putting it together. But yes, it's what happens is, again, not to get technical, as the problem gets more severe, your gum detaches from the tooth. That creates a different environment out there. It's dark, it's wet. Is
that what a pocket is?
There's no oxygen. Exactly.
Okay.
That's what a pocket is. When you get all that...
See, that's the best explanation I've ever heard.
Well, now the bugs are changing into a very, I would say...
So the bugs live under there?
Yeah, but the bad bugs now. So we all have millions and billions of bacteria. So the issue is that once that transfers into bad bacteria, that's when the faster bone loss is going to start happening.
So cut it out or just laser it out.
That's right.
I was talking to one of my friends in Colorado. He's a periodontist, right? And he said the problem with the laser, Randy, it's a lot of work. Because it's technically demanding. It's not as easy as for the doctor to do, right? Because it might even take me longer to do it that way. And one of the things you said in our green room, you said, it takes me longer, Randy, but it's better for the patient.
Right, and that's exactly what I was going to say. That? It is true because not that we're looking. Again, we're looking for two things. One is effectiveness, how effective this thing is. And two is what's the best for the patient. So in reality, the more advanced the problem is, the more severe, the more bleeding, the more puffy gums, the more effective this laser is going to be. So I'm getting the patient, sometimes even before the hygienist have seen it. They come in for consult and then they go immediately into this laser treatment. That's why it's a shorter time. It's well described that it takes probably an appointment or two. However, we as a periodontist, we're dealing with it from the beginning. So I have half of the job which the hygienist used to do. Now I have to do it all together.
If 60 million Americans, and I Googled this, have either an upper or lower denture, that means they lost their teeth. That if you could, what's your hunch? This is totally your opinion. I'm going to put you on the spot here.
Okay.
How many of those, if really treated early with this laser, I mean early on, would you have eliminated?
You know what?
Most of them?
I would say at least 50 or plus %. I mean, half of the population, unfortunately, a lot of these issues, when they're caught early on, is when it's effective. The more severe, the less likely to work.
But that's the challenge you as a periodontist. They come to you when their teeth are falling out or they can't even eat. Is that right?
Right. Often. I mean, they do.
So you want them early?
That's right.
Like bleeding gums, bad breath, puffy, early onset.
When we do early on treatment, we know it's going to work. When you have, again, going back to your definition of pockets, you got shallower pockets, it's effective. Very deep pockets, not so effective. So that's the same thing. Now, if you are seeing already teeth migrating or moving or your teeth being apart, I think that is...
So teeth are moving, why?
Because there's just no much foundation. The foundation is receding as well. So you're losing bone.
So the bone also...
That's right.
This bacterial infection eats away at the bone?
That's basically it. I mean, I
know this is a long explanation, right?
Well, yeah, it's your body that, basically.
Because, I had a dentist tell me one time, a periodontist said, Randy, and this was his theory, that like anything in the body, this infection is forcing the teeth out of your mouth. That's why you lose a tooth.
Well,
because the bacteria doesn't live.
What happens is...
It loves...
That's right. The bacterial challenge creates this immune response. So your body is literally eating the bone away.
To push out the tooth.
Trying to defend. Yeah, try to get... if you were to say that the tooth is where the bacteria exists, that's why they're trying to get rid of it. Yeah.
Okay, good. So kill the bacteria with a laser. Now, the other thing is this. So people watching this need to know this is a real interview. I'm not trying to side with you. I do like this technology. It seems if what you're saying is accurate, it makes sense. Okay?
Right.
But the other part is people always ask me for referrals. Who should I go to? This and that. I always say go to a specialist, right? You're the gum specialist. If you have gum disease, I say go to periodontist. But here's the thing that you said to me over there, if you're going to go to a periodontist, and I don't want to put words in your mouth here, go to one that does both.
That's
traditional
right. That's exactly
and as a
right.
laser.
That's right.
Why?
I think that because I don't want to sound like everything has to be laser. There are specific cases, and I don't go into having excessive gum tissue around it or needing some restorative treatment at the same time. There are still some instances that you will require potentially conventional surgery. But if you only go to a doctor, a periodontist that only does conventional, then you don't have your full options.
So if all they do is the cutting.
That's right. So you have to have a periodontist. First of all, going to a specialist doesn't cost more than going to a general dentist.
Is that right?
That's right. And then the second thing really is that if you go to a doctor, you should have access to all your options. So you have someone who does the conventional and make sure they have the ability to do that LANAP protocol, which is basically that perilace.
Okay, so and what do you ask them? Do you do also laser for periodontal treatment?
That's right. I mean, that's really, can I basically assess my options? I want to know if I'm a candidate for laser or should I do conventional surgery.
So less than 10% of all dentists in America have one of these lasers.
Not for
too long.
Right? Yes.
And even less than that when it comes to periodontists that have these lasers.
Well, actually, what I learned lately is on the American Academy of Periodontology, for example, which is, we have a high participation in periodontists, it's now above 15% of the periodontists are already acquiring the laser.
The lasers.
So, yeah, it is catching up. And I think that the more we do, interviews like this, we are in the media, publications are coming up right now. I mean, recently in October, there was a new publication coming up. The more we do this, I think it's going to become the trend.
So there's scientific.
Well, patients are going to request a bit or require.
They're going to want.
Yeah,
they're going to want
right.
the laser.
Yeah.
And the future of dentistry, you think, because you say lower levels, they can go around their mouth.
That's right.
With a laser.
Well, there is a protocol for even hygiene. During your hygiene appointment, it's almost like you are, as we were talking about it, almost disinfecting your mouth.
It makes sense to me.
Yeah, it does. I mean, you just work in different settings. You just clean the whole mouth. And
I asked my dentist about it, hygienist. She says, I think I heard she said the problem with that is it burns the roots.
Well, it's because...
Is that a silly statement, by the way?
Not at all. It depends on which laser you're using. That's what we're talking about, 20 different lasers. You could do cavities with laser. If you're not careful at all, you could burn your lips. There are many things that you could do. Again, safety first.
Okay.
You got to be properly trained
but
and have the right laser.
there's a regeneration. Look, I interview a lot of dermatologists, plastic surgeons, and it's funny. 14 years ago, my show started. The plastic surgeons were poo-pooing or saying, "Oh, lasers, this." Now they all have lasers, and it turns out that when you heat the skin, heat the underlying tissue, that it builds collagen,
right,
and it restores the skin. And you've told me the same thing happens with this laser. That you could take really ugly-looking gums and make them look better.
Right, that's exactly.
They regenerate in a way?
You're just removing the bacteria, so allowing your body to regenerate it. And that's a key difference that's why you don't end up with longer teeth or teeth that look longer.
Yeah, but I think isn't the problem, though, that if your insurance covers the surgical procedure, it's not going to cover
the
laser
really.
procedure.
They will cover both, actually. It's just the same thing. If they cover the pocket reduction of the conventional treatment, they will cover laser treatment.
I always say the best interviews on my show, if I could get a guy to come in here and tell the truth and not be politically correct, but are you 100% convinced, if you've been told you have gum disease, to look for a periodontist that has a laser, and of course, if they're a periodontist, they're trained in the traditional method.
Right. That's where I'm saying, I mean, I believe that someone with gum disease should consult a periodontist
that does both.
Will have both.
I always want to ask you, as a periodontist, did you always know, because now it's mainstream, traditional medicine knows this infection leaks into your bloodstream. Did you, as a periodontist, with your training, did you guys always know this?
Listen, the periodontal literature has been trying for a long time, probably late 90s. I'm not saying that, finally, recently...
did you personally always feel like there was a connection with the rest of the body?
It was part of my training, yeah.
Okay.
I remember reading about it, yeah.
Nobody would listen to you guys back then.
That's pretty much it, exactly.
But you knew it, okay.
That's right.
Final message. Okay, so if I know somebody with puffy red gums. Actually, I don't know them. I saw them over the weekend. Knowing you were coming and I'm going, that's gum disease. But what does it mean? If somebody has puffy gums, are you saying that underneath that is this infection that's going to make them lose their teeth if they do nothing?
That's right.
Is that right?
It's a process that will not stop until we clean it up.
So you could just go in there and zap it?
The difference is we got two differences. You either cut it out or you laser it. You cut it out.
I want the laser.
That's right. I'll choose
I'm
that
sold,
too.
Doctor.
Exactly.
Okay. Now you brought a video, and we have to show this video. This video is of the laser procedure. It's from the manufacturer, Millennium. What are we looking at here with this video?
Well, basically, it's an animation that shows how the laser works.
Okay, good. Let's go to the video.
This is the video animation of the FDA-cleared periodontal procedure called LANAP, an acronym for Laser-Assisted New Attachment Procedure. The fiber optic tip is gently placed at the top of the periodontal pocket to begin removal of diseased tissue that lines the pocket. This is where bacteria live and build a neighborhood of its own that destroys healthy gum tissue and bone that holds your teeth in their proper position. There are specific germs and bacteria that cause gum disease. The Periolase laser is designed to target and eliminate selectively only the diseased tissue and germs, dissolving toxins and leaving the healthy tissue unharmed. The laser tip is then removed from the pocket and set aside. In the next step of the procedure, ultrasonic cleaners as small as a laser fiber tip are used to remove the hard deposits we call tartar or calculus from the top of the teeth and roots. These instruments use sound waves to vibrate and break apart the hard mineral calcium deposits, with water flushing away the debris and cooling the instrument tip. Some hand cleaning instruments may be used at this time to remove any remaining hard calcium deposits. Then the laser is used again at the bottom of the pocket to remove any remaining diseased tissue. This pass of the laser also sterilizes the tissue and bone and completely eliminates the bad bacteria, germs, and toxins. It also stimulates the formation of a blood clot, which once formed contains fibers that reattach your tissue to the tooth surface and seal out debris and bacteria like stitches would, and creates the right environment to cause the bone and other soft tissues lost from the disease to grow back.
Pretty good. So is that an oversimplification? Because it looks
it's actually
looks like wow. I mean, this is what,
it is. It is simple. It is as simple as it's shown. It does basically biologically takes care of the infection, and patients are happy home.
So you've done your friends and family. Do you think you're going to get it done for prevention one of these days?
Potentially,
you personally,
right? If we
at a lower level,
if we establish a protocol that's what we're going to happen. I think part of it right now is training, is safety, but the more we get used to this, and we're going to get now auxiliary training, basically getting our hygienists to do it, which now they're programs to do it, is going to be an everyday thing.
Okay.
It should happen.
So somebody watching this, bleeding gums, their teeth are starting to flare or get loose. It hurts when they chew.
Yeah, bath breath.
They don't. Do they need a referral to go to you first?
No,
Because you say early treatment is better.
They got to pick up the phone, call us up, talk to Kelly. She'll set you up for a consultation. We'll be glad to see you.
Thanks for coming to the show. Very interesting.
Thank you, Randy.
And
it
do
was
you have
great.
this information on your website?
Definitely. There's a lot of information there, but they could call anytime and find out more.
And insurance may cover it. I mean, if it covers the surgical procedure.
That's correct. They will cover it.
Thanks so much. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again online, if you live in the Boston area, or you've got to tell a friend about it, just visit wellnesshour.com, put in Dr. Guzman. You'll find him there. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.